Thank you very much for enormously interesting presentation. Before we move to another guest, I would like to walk you through how you can ask questions to our speakers because it's not very intuitive. In the menu down there, you got to go first to participants. You pick the participant you would like to ask a question, and then please hit the bottom question. Thank you so much for your cooperation. We are very much looking forward for your questions in the panel session. And right now, please let me welcome here our another guest, Dr. Andrew Jagim from Mayo Clinic.
All right, thank you for that introduction. Can everyone hear me okay? Okay, so I'm going to go ahead and get started here. So greetings, everyone. Thank you for joining me for my presentation. The title of my talk today is Creatine Supplementation in Children and Adolescents. So Dr. Ellery did a great job of summarizing a lot of her current projects, which ties in really nicely with this topic as we kind of continue throughout the lifespan here. So just a brief background about myself. I'm currently Director of Sports Medicine Research for the Mayo Clinic Health System located in La Crosse, Wisconsin. Also an adjunct faculty member in the Exercise and Sports Science Department at the University of Wisconsin in La Crosse. And so I've dedicated a large portion of my career to studying the efficacy of creatine, frequently with and without beta-alanine in terms of its performance implications. And then also when we combine these two nutrients in addition to other products in kind of a combined pre-workout type of a blend. So I'm excited to share some of that work with you all today, and also excited to just kind of join the other host of great speakers that we have as part of this really exciting event. So today's discussion, what I'm going to focus on is kind of summarizing a review article that my colleague, Chad Kirksick, and I published as part of the special issue that came out in Nutrients, as Dr. Kreider alluded to earlier. So our review kind of summarized a lot of the available literature regarding creatine supplementation in children and adolescents. We'll kind of get into a brief overview of creatine and then discuss some of the prevalence in terms of how many athletes or how many adolescent athletes are currently supplementing with creatine, and then also get into some of the efficacy of creatine supplementation strategies as in regards to increasing internal phosphocreatine stores, the implications on physical performance parameters, also some of the clinical applications, and then also discussing some safety considerations and then areas for future research. So creatine, this has already kind of been summarized previously, so I'm not going to go into a lot of detail about it, but as kind of mentioned earlier, it's an amino acid-like compound. We endogenously produce it within the body. We can also consume it through food sources, as it's primarily found in animal-based products. Within the body, it's primarily stored in skeletal muscle tissue, also located within the brain, is something that we'll get into a little bit later in this presentation. And it serves a valuable energy source through this enzymatic reaction involving creatine kinase. So Dr. Bonilla, again, eloquently described this process and some of the metabolic rationale of creatine metabolism earlier. And that certainly kind of extends to what we would consider children, youth, and adolescent populations as well. So the physiological rationale and kind of potential for benefit really extends to this population that we're going to be discussing within this presentation as well. So kind of rooted in that cellular energy kind of physiological rationale. So as we know, as we've discussed, creatine is one of the most popular dietary supplements among adult populations in regards to its performance benefits. And like I just mentioned, there really is a similar rationale from a physiological and metabolic standpoint as to why this supplement would confer very similar benefits. And now, as we learn, clinical applications in children and youth populations as well. However, with that being said, there is still a lot of misconceptions and hesitations when it comes to recommending creatine for youth and adolescent populations. And so through my position, I do a lot of research. We coordinate a lot of research in this area, but I also see patients. And so one of the more popular questions that I get from adolescent patients and also oftentimes their parents is, what do I think about creatine? And so obviously I refer to the literature as best I can, but still there seems to be a lot of hesitation that I get from parents. And some of it comes from their coaches, and some of it even comes from the athletic organizations that they're participating in as well. So I know there's several state high school athletic associations that prohibit creatine for their athletes and sometimes even prohibit just the discussion of it. So coaches, athletic training support staff, athletic directors almost have a zero tolerance policy when it comes to, again, even discussing creatine. And so hopefully events like this and more research in this area helps to kind of correct some of this misguided hesitation, as I would say, when it comes to creatine in adolescent athletes. I understand some of the hesitations, but really, again, I think it stems from a lot of outdated and misperceptions. And as Dr. Crowder alluded to earlier, we have a really nice review paper out on this particular topic, just kind of addressing some of these misconceptions and myths when it comes to creatine. And hopefully, the more that word gets out, we can kind of um, put to rest some of these longstanding misconceptions and hesitations when it comes to creatine among this population. So even with those hesitations, even with some of the barriers when it comes to recommending creatine supplementation for adolescent athletes, if we look historically through some of the survey data that's currently available, we know that a fair amount of athletes are already taking this supplement, which makes it even more important to kind of continue studying it so that we can provide more evidence-based recommendations for this population, because there's evidence of use for creatine going back into the late 90s across a wide age range. So if we look historically at some of these trends and some of the available survey data, even into the early 2000s, among a cohort of 600 high school student athletes within the United States, first they found that about 75% of them were at least aware of creatine, which I think is kind of interesting considering it wasn't that popular at that particular time and hadn't been around again historically for long periods of time. So I consider that to be a positive. And then about 16% of those athletes, those student athletes, reported some level of current or previous use. And so a similar trend that we'll see here with the upcoming data is that there's definitely some gender differences when it comes to creatine supplementation rate. So much higher that we see in male high school or adolescent athletes compared to females. So in this particular sample, it was about 23% compared to 2%. And then similarly, we see some discrepancies across kind of some subgroups in terms of age. So the higher grade levels, in this case, 12th graders, there was a much higher supplementation rate in terms of creatine compared to the freshmen or the ninth graders. And so again, even within this cohort, or within those reporting current or previous supplementation of creatine, 97% of those athletes, indicated some type of perceived benefit from creatine, again, which is great to hear. And then when we look at their supplementation habits, the majority of them kind of follow the standard short loading phase of anywhere from 5, 10, sometimes upwards to 20 grams over the course of several days or a week, and then typically dropping down to a maintenance phase. So again, it's kind of nice to see that align with a lot of the evidence-based supplementation strategies, even though now we kind of realize that just pursuing with that maintenance dose is probably adequate for the long term. Shortly after, another sample, this time much larger, 4,000 high school student athletes within the US, about 17%, so very similar to that previous 16% in the first study. But again, a similar gender discrepancy here, much higher report in males compared to the female adolescent athletes. And then here they actually stratified it by sport type and found a much higher incidence of creatine supplementation among football players compared to other groups such as cross-country runners, where only about 1% of them reported using creatine. Shortly after that, in 2004, among a sample of Canadian adolescent student athletes, they found only about 5% of those surveyed reported using creatine. Clearly, they weren't aware of Darren Candow and Scott Forbes' work yet at that time. So, and then in 2012, among another sample of United States adolescent athletes, this time a much higher prevalence of creatine supplementation, now into the 30s. So about 34% of those surveyed reported using creatine. So you can see a little bit of an upward trend here historically throughout the years, and that prevalence rate actually aligns quite nicely with what we see at more the international level, or athletes competing internationally at more of an elite level. So if we look across the pond and among a sample of elite adolescent athletes from the United Kingdom, Again, here we have a prevalence of use of about 36% of those athletes surveyed reported supplementing with creatine. And then there was a strong relationship between the reasons for them supplementing with creatine and the physiological rationale. So again, it's good to know that they kind of understood why they were taking creatine and then some of the purported benefits of doing so. In 2008, among another sample of adolescent athletes from the United Kingdom, about 28% of athletes self-reported creatine. And then more recently here, among a sample of male and female adolescent athletes across 4 different countries this time, 25% of them reported supplementing with creatine. Again, a similar discrepancy among those supplementing, much higher rate among the male adolescent athletes compared to females. It is worth noting here that among those supplementing with creatine, we do see this, or we start to see a much higher rate in terms of female adolescent athletes reporting the use of creatine supplementation. And so again, I think that trend would likely to continue here if some of this work were to be repeated. And we also see, again, that similar discrepancy among some of the different age groups. So if we look historically, again, at some of these trends in terms of the prevalence of creatine supplementation and then future projections, while it does appear to be popular among certain adolescent athletes, particularly more so in those competing at the elite level and among international competitions, comparatively, it's still much less frequently than what we see with other dietary supplement categories, in which prevalence of supplementation rates range anywhere from 60 to 80% among adolescent athlete populations. And other products that would be included there would be protein powders, multivitamins, other energy promoting products, and so forth. So again, with creatine, we saw 5, 15, maybe upwards to 30% of athletes supplemented with creatine. But again, that's still a bit below some of the other dietary supplements that are frequently ingested among that sample or among that age group of athletes. I do believe there's kind of a need to replicate a lot of the survey based studies among these populations, just because of the landscape of the dietary supplement industry now compared to the early 2000s, and certainly introducing social media into this equation, because the way adolescent individuals and athletes are consuming information and just the accessibility of information through social media has likely substantially changed just the way they're obtaining information about supplements, how they're learning about them, maybe how they purchase them. And so I would suspect that a lot of these trends in terms of dietary supplement use have likely changed quite a bit, even in the last 5 years, as we've just seen this kind of explosion in social media and just how that world or how that age group consumes a lot of their information. I just look back at my childhood, and the only way to really learn about supplements at that time was through bodybuilding magazines or in muscle and fitness and so forth. Not that I read a lot of scientific articles as a teenager anyway, but just still now this information is so much more accessible. And so it likely has altered some of the patterns in terms of dietary supplement use. So this is something we're working on, is just trying to recreate some of these survey data projects among that age group. Another interesting trend in terms of creatine consumption, this time through dietary food sources. And just a quick caveat here, I'm not going to go into a lot of detail because I know this is going to be covered in another presentation, but it really is kind of pertinent to our discussion here with this particular topic. Because if we look historically within the United States, there's actually been a downward trend in creatine consumption through dietary foods. So it's kind of been a steady decline since the late 1990s, in which for every kind of year they analyzed some of this survey data available within the US, they found decreases of about 2 milligrams in infants and then about 3 milligrams in children and adolescents. And then also, interestingly, within the same study, they found differences in just kind of the size and body stature of children across different quartiles of dietary creatine intake. And so specifically, height, weight, and BMI were all significantly higher in those representing the 4th quartile of creatine intake, which was established at a threshold of above 1.5 grams per day. And then so each additional 0.1 gram of creatine consumed per day increased height by 0.6 centimeters. And then kind of overall, the daily intake of creatine from a regular diet in taller children in adolescents was higher than those in shorter peers. And so this certainly suggests that creatine is an essential nutrient for just the normal growth, development, and maturation of children and adolescents kind of throughout those rapid years of growth and development. So I know this is different than creatine supplementation, but certainly kind of, again, highlights the importance of why children and adolescents should be consuming either animal products or getting creatine somehow incorporated into their diet to, again, help facilitate that normal growth and maturation. And so obviously we need to tease out more the reason for some of these shifts in dietary creatine intake. It could be because of different trends with more plant-based diets or vegetarian type diets, and what was even mentioned earlier of just the concept of maybe incorporating creatine into other vegan type foods and kind of serving more of a functional food type of role, I think is really interesting because it may help maybe reverse some of these trends in terms of kind of global dietary intake that we see through food alone. So again, certainly interesting to see some of the upcoming work in this particular area. And so the reason why it is important is we look at dietary intake through the food is it plays a big role in what baseline kind of muscle creatine or phosphocreatine stores are going to be within the body. As we know, as has been mentioned earlier already, kind of baseline creatine intake, again, is heavily influenced by exogenous consumption of creatine from the diet. We do also know that we can improve creatine stores through various supplementation strategies. And so within adult populations, again, we can see anywhere from 15 to 40% of an increase in internal creatine stores coming from various creatine supplementation strategies, which can then have various and kind of subsequent effects on performance parameters, certainly some clinical outcomes as well, as we'll get into here shortly. But what we don't know as well is how effective creatine supplementation strategies are in children and adolescent populations. There's just not quite as much available literature within this population as what we see in adult populations. Yes, we can probably assume there's a similar type of increase as what we see in adults, but as we know in science, it's not always great to assume things. It's important to kind of look at the data and look at the available research in this area. So if we do that, if we look to some of the available literature in 2017, there was a study that examined changes in brain and muscle phosphocreatine content using magnetic resonance imaging strategies following various creatine loading protocols. So in this case, they use 0.3 grams per kilogram per day over a course of 7 days. And they actually stratified or recruited and enrolled individuals across 3 different age groups. So they had children, adult omnivores, adult vegetarians, and then elderly adults. And overall, they found a 13.9% increase in intramuscular phosphocreatine content. And they actually found a larger increase in brain phosphocreatine levels among the group of children. And then kind of comparatively across the different age groups, there was a larger increase in muscle phosphocreatine content observed in the elderly, but not necessarily the adult omnivores when we compared them, or when the authors compared them to the children. A similar study in 2010 supplemented pediatric patients with muscular dystrophy over an 8-week period. In this case, they provided them with 5 grams of creatine per day, and they reported a mean increase of about 4.7% in the creatine supplementation group compared to placebo. So again, there is some preliminary evidence indicating that various creatine supplementation strategies can positively influence internal phosphocreatine stores. However, there have been contradictory reports in other studies. The challenge sometimes when comparing these outcomes across studies is oftentimes there's different supplementation protocols that were employed. And then additionally, oftentimes some of these were in pediatric clinical populations where there's certainly some underlying conditions and comorbidities that may influence the ability to absorb and store internal phosphocreatine. So again, a lot more work needed in this area to really kind of tease out some of these knowns in regards to creatine supplementation and the magnitude of increase that we can see in children and adult populations through these different supplementation strategies. In particular, what really needs to be kind of more well established is whether or not there's a need for any age specific dosing recommendations. And then again, the magnitude of increase that could be seen through some of those differences in dosing strategies. The challenge, as many know who have tried to do work in this area, is some of the age and ethical considerations and barriers of doing this type of work. Very challenging to do muscle biopsy work when you're dealing with children or adolescent populations, unless there's a clinical need or more of a justification of doing that type of work. So as a result, oftentimes these studies rely on various imaging strategies or other kind of laboratory markers as indirect measures of creatine and phosphocreatine content, rather than relying on, again, muscle biopsy work like we can do, I would say easier, but which is more common, I guess, in adult population. So again, through some of this future work, hopefully we can solidify some more age and maybe body size specific dosing recommendations, using kind of more evidence-based recommendations. So I get asked this question a lot by patients and their parents of, if their child or young athlete wants to consider supplementing with creatine, what do I recommend for a dose? So I use this table to kind of guesstimate using more adult specific population or dosing strategies, excuse me, and just kind of taking some of those weight specific or relative dosing strategies and then just calculating it for the different body sizes of the child or adolescent athlete. So again, I even really don't recommend a loading phase among this group. If they were to do so, this is kind of what the math would dictate in terms of a absolute loading dose, in terms of grams per day. So a 30 kilo athlete, about 66 pounds, would be about 9 to 10 grams potentially per day. And then in terms of a maintenance dose, this would be closer to a gram per day. And so you can see kind of with increasing body size comes slightly higher recommendations in terms of a loading dose or a maintenance dose. And then comparatively in adult populations, that typically comes out to, as we know, maybe 15 to 20, even upwards to 30 grams per day. And then for a maintenance dose, that would be more in line with 3 to 5 grams per day, which I think is more than sufficient for most children and adolescents if they want to supplement with creatine. But again, this is just really extrapolating a lot of the available literature in adults, and kind of just adjusting for body size here with pediatric or adolescent populations. So again, hopefully one day we can have more evidence-based recommendations for those, and whether or not there is a need to adjust some of these relative dosing recommendations for these individuals. So if we look, kind of shifting gears here a little bit, and look at some of the ergogenic potential of creatine supplementation among children and youth athletes, there have been a handful of studies that have been done with adolescent athlete populations. A lot of them kind of mirror some of the work that's been done in collegiate or amateur and adult athlete populations. But currently, if we were to just kind of summarize a lot of the work in this area, the majority of them have focused on either swimmers or soccer athletes. And then the average age of a lot of the individuals in these studies was about 16 to 17 years. So sometimes that can have implications in terms of the ethical approval and the informed consent process, again, depending on the country and the specific age to provide consent, or if assent is needed in certain situations. And I think logistically, that's probably why a lot more of this work has been done internationally compared to within the United States, just because of some of those potential barriers. The average kind of supplementation period, some of them were just more short loading specific studies, or utilizing loading doses where it was about 7 days in duration, whereas others were supplemented as long as 11 weeks. And so kind of summarizing again the outcomes here across the board, there were pretty consistent improvements in sport specific aspects of physical performance. So whether it was a sprint swimming test, repeat swimming test, anaerobic capacity measures, interval performance, or if it was more soccer specific tasks such as repeat performance, dribbling performance, again, pretty consistent improvements in sport specific performance following various lengths of creatine supplementation and various dosing strategies. And then just to add, even more importantly, none of these studies reported any adverse events from the supplementation, with the exception of one in 2005, where some of the subjects reported some gastrointestinal discomfort. However, they were in the creatine monohydrate and carbohydrate group, so it's difficult to specifically identify which might have been more problematic. But again, um, overall, it seems to be well tolerated among this population. And again, consistent evidence indicating performance benefits, again, similar to what we would see in older adult or collegiate athlete populations. So just kind of summarizing it, we do know there's about 10, 11 studies that have been done internationally with adolescent athletes in terms of the efficacy of creatine supplementation, but certainly more work needed in this area to kind of better evaluate some of the specific aspects of creatine supplementation in terms to other types of exercise or other sport specific tasks. And then I would say even more urgently is more work in this area incorporating female athletes, which unfortunately is kind of a common trend across the sport nutrition literature. I know one that's slowly shifting, but certainly we need to kind of speed that up a bit. I know there's some great groups out there dedicated to kind of shortening that gap a little bit, but to date, there's no female adolescent creatine supplementation study currently available within the literature. So again, hopefully this is something that we can change here in the near future. So shifting gears here, focusing a little bit more on the clinical applications of creatine supplementation in youth. And this is one that I think is the most exciting because the types of benefits and improvements that we see within this kind of specialized patient population really are life-changing benefits. And yes, I know I'm an old athlete. I always like seeing sport-specific studies and making a positive impact on sport performance. But to be able to change the life and kind of future clinical outcome of some of these patients, it really is truly amazing to see some of this work. And I really think we're just scratching the surface here when it comes to more the widespread clinical applications of creatine, really for all populations, but certainly among youth and more of a pediatric population. So this has kind of been brought up a little bit previously as well with some of the creatine deficiency disorders, but the discovery of inborn errors of metabolism really have kind of shifted the landscape of some of this work. And so really what it did is it identified some important physiological, neurological, and even neuroprotective benefits of creatine, which has then kind of led to the therapeutic use of creatine among some of these specialized pediatric populations. So the majority of this work and available clinical trials have focused on some of these creatine deficiencies and creatine transporter deficiencies, which again represent inborn errors of metabolism, but then also getting into more neuromuscular disorders and even myopathy. So the review article that Dr. Kirksick and I put out, we kind of consolidated and provided a summary of all the different clinical studies that have been done among these different patient populations. So unfortunately, we don't quite have time to get into a lot of detail with some of them, but I am going to kind of highlight some of the more notable therapeutic uses of creatine, and in particular ones that I think the magnitude of benefit is probably the greatest. And that's for these inborn errors of creatine metabolism that we collectively kind of characterize as cerebral creatine synthesis deficiencies. And so Dr. Kreider summarized these in kind of that initial article that came out in this special issue. But these deficiencies really can lead to some profound intellectual and kind of developmental delays among these infants and children. And so through the use of different creatine supplementation strategies, you can restore the tissue creatine content and really improve some of those symptoms, and again, create some kind of life-altering benefits for these infants and pediatric patients. And so there was a nice case study that kind of led some of this work in the 90s, where they identified someone with that deficiency, implemented a creatine supplementation strategy of about 4 to 8 grams per day over the course of 25 months, and reported substantial clinical improvements and normalization of brain MRI abnormalities, and then also improvements in EEG readings and post-treatment. And so the list kind of goes on with similar types of case studies or case series that appear throughout the literature of situations where children were identified with this particular deficiency. A therapeutic kind of strategy using creatine as an adjunctive therapy was incorporated. And again, they found some pretty profound improvements in some of those clinical outcomes. So AGAT deficiency is another one of these inborn errors of metabolism. This one's a little bit more rare than the GAMT deficiency, but it again results in very similar intellectual and developmental disorders, speech delays, autistic like behaviors, but also thankfully appears to be treatable with creatine supplementation. So again, another case study in which a 9-year-old pediatric patient was identified with this deficiency, provided creatine over the course of an 8-year period. You can see a much higher dose than what is sometimes used for other creatine supplementation strategies. And again, they found some partial recovery of cerebral creatine levels, and then also improvement in some of the clinical parameters associated with that deficiency. So again, really exciting work with those creatine deficiencies. There are some creatine transporter deficiencies that are somewhat similar in terms of their presentation. However, the kind of physiological specifics of this particular disorder unfortunately don't lend itself to creatine supplementation as much, because it's more of a deficiency with the transporter itself, not necessarily in the synthesis of creatine within the body. So it's not as responsive to exogenous creatine. And as such, a lot of recent research has shifted into looking at more or identifying alternative strategies that may enhance brain creatine content by helping to kind of transport that creatine across the membrane itself. So looking at the use of different creatine fatty esters, lipid nanocapsules as kind of a nutrition-based therapeutic treatment to help transport that creatine across the membrane to better cross that blood-brain barrier and then ultimately correct that deficiency. So again, really exciting to see some of this work. Really interesting to kind of see where it goes in the future in terms of correcting some of those inborn errors of metabolism. So another popular area of study within pediatric patient populations is the implementation of creatine supplementation for various myopathies. So kind of generally, these are characterized as a muscle disorder pathology that can result in reductions in creatine and phosphocreatine content, in addition to various neuromuscular impairments, muscle weakness, etc. So again, kind of identifying a strong physiological rationale as to why creatine could potentially be beneficial among this population. So Dr. Tarnopolsky and his group did a lot of great work in the 2000s supplementing patients with muscular dystrophy with creatine. And so this particular one that was done in 2004, they supplemented patients about 0.1 grams per kilogram per day over the course of 4 months, and then incorporated a 6-week washout with a 4-month placebo. And they found favorable improvements in fat-free mass and hand grip strength in those pediatric patients, in addition to reductions in a marker of bone breakdown. And then overall, it was very well tolerated among this population without any abnormal changes in any of the clinical markers. So again, another really great application of creatine among a specialized population. Another avenue or potential clinical application of creatine supplementation is the potential role in kind of treating or improving the recovery of patients suffering from traumatic brain injury. So in 2006, there was an open label pilot study in which they supplemented 39 children or adolescents, age ranging between 1 to 18 years old, with creatine at a dose of about 0.4 grams per kilogram. And they found improvement in cognitive, personality behaviors, self-care, communication aspects in all patients without any side effects from that creatine administration. So it's kind of preliminary data. So far, we're actually working to do a similar study among collegiate athletes following concussion to see if there's an influence of creatine supplementation on the recovery following that concussion incident among that athletic population. So again, a lot of exciting work in that area in terms of clinical applications, and certainly excited to see kind of where that goes among different groups of patients and different kind of specialized patient populations among that age group. So shifting gears here and kind of continuing with the clinical concept, but looking more so at the safety of creatine supplementation. As I mentioned earlier, I get asked this question quite a bit by patients and their parents of whether or not is creatine safe, or sometimes even extending to other dietary supplements. And my first response is yes, but then it is kind of more nuanced than that when it comes to really any dietary supplement, because they all get included in the same category. However, they're not all made and manufactured the same way. So I kind of get on my soapbox and give them my rundown of, well, it really depends on what type of product it is, who's manufacturing it, do they follow good manufacturing practices, are there any quality control measures in place, do you have any underlying medical conditions or reasons why you shouldn't be taking it, are you following the dosing recommendations, and the list can go on there. So again, generally speaking, yes, I believe there's enough evidence to support its safety. We certainly see it in some of these clinical populations, and then also not a lot of adverse events reported in more of the athletic type of adolescent populations. But again, it really kind of comes down to the specific brand and quality control of that particular product beyond just the ingredient itself. And again, Creapure, I think, is the best in terms of manufacturing a high quality source of creatine. So it's important to kind of choose products that get that type of creatine sourced in their ingredients, and then hopefully also it has one of these other labels of third party testing just to ensure another layer of quality control. Because again, I think sometimes this is where some of the misconceptions stem from in terms of creatine, is there's case reports in the literature of some type of incident happening. Somehow creatine gets lumped into the conversation, but if you read into the details, you also find out they were on banned stimulants, taking high doses of steroids. But somehow people always look to creatine as the culprit in those types of scenarios. So again, it really depends on what else they're taking, what else is in that product, who made it, and so forth. So it's important, again, to have that conversation with any dietary supplement, and then creatine also fits in that category as well. So again, the summary of creatine in adult populations is really nicely summarized in that 2017 position stand that Dr. Kreider mentioned. And then keep an eye out for an updated review on that topic coming in, I think, this second special issue within Nutrients. So beyond that, there's not a lot of specific studies and available literature of the safety of creatine in adolescent athletic populations. There's no indications to indicate why it wouldn't be safe or why it wouldn't follow a similar safety profile as what we see in collegiate or amateur athletes. All the studies that I mentioned earlier, none of them reported any adverse events from creatine supplementation. And then even looking at the clinical populations, a lot of those studies closely monitored laboratory markers as they were being treated for other types of conditions. And in none of those studies or in none of those clinical trials were there any adverse events or abnormal changes in any of the markers of clinical health that are commonly used in those types of clinical settings. So again, I'm confident in saying that it is safe for that population. We do need some more data supporting that hypothesis, especially ones using kind of a prospective randomized controlled trial design. I can tell you Dr. Kirksick and I are trying to get this study done as we speak. And hopefully that will maybe put some of those myths and misconceptions at bay again to have that available evidence. I think another thing that's important to mention here is that within the United States, the Food and Drug Administration has kind of designated creatine as a generally recognized as safe ingredient or GRAS status. And so what this means is that creatine in and of itself is considered safe under the conditions of its intended use based on the currently available scientific evidence as depended upon by a panel of qualified content experts. So that's directly from the FDA's website. And so again, I also generally bring this up in conversations talking about its safety, because this is one of the highest levels of approval that an ingredient could receive within the United States and our kind of regulatory body. So again, this is certainly something that's important to be aware of, indicating and supporting creatine safety. So wrapping things up here a little bit today, conclusions and future directions. There is good evidence of creatines commonly being used among adolescent athlete populations. Generally, anywhere from 15 to 35% of athletes report already or previously taking creatine. And as I mentioned earlier, I suspect this trend will likely go up as more evidence accumulates supporting its safety and efficacy of various populations. But then also just the way the dietary supplement market has shifted as of recent, I think these trends likely would be up and higher. And again, we see the highest rates of use among male athletes and typically those competing internationally at an elite level. There's been a small number of studies that have reported ergogenic benefits of creatine supplementation among adolescent athletes. As we noted earlier, the majority of those were in swimming and soccer players. And importantly, no adverse events were reported within those studies. With that being said, there certainly is more of a need for education regarding safe and effective dietary supplement strategies. Certainly, kind of addressing some of those misconceptions that have been brought up, especially I know in the clinical world that I'm in, there's a lot of misconceptions, again, within some of the practitioners that I frequently encounter with. But then also in the dietetics world, athletics world, again, particularly at youth and adolescent sport levels, the fitness industry, et cetera. We just kind of need more updated information and guidance across those different disciplines. Several of the previously published studies in healthy adult populations really should be replicated in adolescents as well, so that we can just kind of confirm some of those ergogenic benefits, but then also, again, supporting more the safety components of them. And then hopefully through that work, we could identify the need for any age or body size specific adjustments if there was a need for it in terms of the dosing strategies for creatine among this population. And then also continuing to explore the potential benefits of creatine among pediatric populations. And I think that's probably some of the most important work that will be done in this area, just because, again, the life-changing benefits that can come from some of those creatine interventions. So certainly keep an eye out in this special issue and ones to come regarding additional resources and information regarding creatine supplementation in children and adolescents. I'm hoping to get a few more articles if we can get some of these studies completed by the time the special issue ends in the next year. And then also a big thanks to all my colleagues and collaborators that I've had over the years. Also a special thanks to the conference sponsors and organizers, Rick Kreider and Jeff Stout, for spearheading this special issue and then helping get this creatine conference put together. It's really exciting to be a part of such a special event. So just kind of briefly included my references there. Obviously look to that review article of ours in the special issue that has much more of a detailed summary of some of those references. And thank you all for listening to my presentation today.